Welcome to this learning module. This learning module will focus on integrating tobacco cessation's 5 A's into your electronic health records. This training is in support of District Project 3BI. The training today is based on the most recent clinical practice guidelines for treating tobacco use and dependence, updated in 2008. The evidence-based guideline recommends that clinicians and healthcare systems seize the office visit for universal assessment and intervention. This is done by implementing a system in every practice to identify the tobacco users, also providing training, resources, and feedback to healthcare professionals, and dedicating staff to provide tobacco dependence treatment. EHRs allow for integration of the guideline into the practice workflow, facilitating system-level changes to reduce tobacco use. Here are the 5 steps to intervention, known as the 5 A's: ask, advise, assess, assist, and arrange. We will discuss each of the 5 A's in the treatment of tobacco use and dependence in more detail throughout this training. The first step in the intervention process of the 5 A's is the ask. It is imperative to systematically ask every patient at every visit about their tobacco use and ensure that their tobacco use status is documented in your electronic health records. Here are some examples of the ask to initiate this conversation. Joe, have you ever smoked? Jane, how often do you smoke? Here is an example of the first step of the 5 A's template, which is the ask. It is imperative that you ask every patient about their tobacco use at every visit and remember to document their response. The second step is to advise your patient to quit using tobacco by using a clear, strong, and personalized message to get your point across, such as saying to your patient, "Do you know the best thing you can do for your health, Jim, is to quit using tobacco?" Let's look at the second step of the 5 A's template, which is the advise. The provider should advise the patient to quit using tobacco and document within their EHR. The third step is the assess. This is done to determine the tobacco user's willingness to make a quit attempt. Every tobacco user should be asked if he or she is willing to make a quit attempt at this time or within 30 days. If the patient is willing to make a quit attempt, provide assistance. However, if the patient clearly states he or she is unwilling to make a quit attempt at this time, provide a motivational intervention shown to increase future quit attempts. This slide is an example of the third step of the 5 A's template, which is the assess. For this section of your EHR template, you need to assess your patient's willingness to quit within the next 30 days, and again, remember to document. This is the minimum requirement based on the clinical practice guidelines for tobacco treatment. The fourth step is to assist the patient in his or her quit attempt. Assisting the patient in his or her quit attempt can be done using either a brief or an intensive intervention. Research has found that the level of intensity of the intervention has a strong dose-response effect. It is important to note that assistance should be offered to all tobacco users, those willing to quit, those not willing to make a quit attempt, and those who have recently quit. Here are some ways to assist your patients. Set a quit date. Arrange support from family and friends. Develop a quit plan. Recommend pharmacotherapy. Give advice on successful quitting strategies. Now we are going to look at the fourth step of the 5 A's template, which is the assist. If your patient is willing to make a quit attempt at this time or within the next 30 days, assist him or her with a quit plan. The important steps of a quit plan, as previously discussed, should be documented within your electronic health records. To assist your patients that are unwilling to quit, help motivate by using the 5 R's: relevance, risk, rewards, roadblocks, and repetition. Here are some examples to encourage your patients to talk about quitting. Relevance. Rosemary, how do you think your smoking affects your ability to play with your grandchildren? Risk. Jim, what do you think will happen if you continue to smoke? Rewards. Cindy, what will you be able to do better if you were to quit smoking? Roadblocks. Tom, is it going to be difficult for you to quit smoking because your wife smokes? Repetition. Pete, follow up on subsequent visits. On this slide, we are looking at a template for the patient unwilling to make a quit attempt by utilizing the 5 R's. There are examples of how the 5 R's can be discussed and documented within your EHR. The final step of the 5 A's is the arrange to ensure follow-up. For follow-up either in person or via telephone. Follow-up contact should begin soon after the quit date, preferably during the first week. A second follow-up contact is recommended within the first month. Schedule further follow-up contacts as indicated. Referrals may be made to the New York State Smokers Quit Line or local resources. Here is an example of the final step of the 5 A's template, which is the arrange. It is imperative to arrange follow-up either by telephone, scheduled office visits, referral to the New York State Smokers Quit Line, or local resources. And again, remember to document. This training module includes example templates to help you implement the 5 A's for tobacco use and dependence within your EHR. If you have specific questions regarding the minimum requirements relevant to your electronic health records, please reach out to the North Country Initiative.